Hello, everyone. This is Melissa Schreibfetter with Functional Nurse Academy, and I'm so happy to have here with me Kimberly Overton, who is our nurse feature for the month. So, welcome, Kimberly. I'm so happy that you're here with me today. And can you tell us a little bit about your background and what you're doing now in private practice?
Yeah, absolutely. Well, thank you so much for having me. First of all, absolutely honored to be here with you and to be your first nurse feature is very exciting. So thank you so much for having me. So yeah, I'm a registered nurse. My background was in critical care. And as you know, I'd worked throughout the pandemic and then started to become very disillusioned with the way that healthcare was going. And I think that even pre-COVID, we know that this system has been broken for a really long time. I think COVID really just opened so many eyes to what was happening and just how broken this system was. So when I decided to walk away from bedside nursing, due to just being uncomfortable with the protocols and things that we were using in the hospitals that were really harmful to patients, I started to understand, being very allopathically trained, that I was going to need to learn how to nurse from a completely different perspective. And we had connected prior to all of that. You're starting this functional nurse academy, so it was really like a divine intervention that we even connected to begin with. But when you started to do the functional nurse academy, I knew right away that this was going to be the perfect fit for me as I'm trying to, really figure out how to take care of my patients in a meaningful way that's going to help get them well. Because this system that we have been a part of I've been a part of for 27 years, is a sick care system. And we know that it does nothing to keep anybody well. So I was so grateful for the opportunity to go through your program and to be able to have this incredible perspective and really see things in a different light, looking at our patients more holistically, and versus just slapping a Band-Aid through prescription medication, which is much of what happens in mainstream medicine. It's more about symptom management and disease management rather than getting to the root cause, eradicating it, and getting people well. So it's been amazing since. I will say I don't do a whole lot of nursing per se myself, because I've started Remnant Nursing, which is now rebranding to Remnant Healthcare. But all of our nurses go through your program, the Functional Nurse Academy, because we understand and we recognize that most of these nurses coming out of the system aren't prepared. They're not prepared. We are prepared, and we take what we can from nursing school, but much of it is not helping to get people well. So we recognize the fact that we need that additional training in order to use our critical thinking skills and go move forward in helping to get people again, getting them well.
Beautifully said. And thank you so much for your support with the Functional Nurse Academy. And like what you were saying about how when we're allopathically trained, we get out of nursing school with really hardly any nutrition training. If we do have nutrition training, it's like an elective course that is based on government guidelines. And I'm sorry, but well, not sorry. The government classifies pizza as a vegetable. And
Or food groups.
yes, and another thing that I was seeing, and again, there's so many training programs out there for nurses, but one of the reasons why I wanted to launch this academy was because one of the reasons why conventional medicine is continuously failing is because they are blindly following guidance from these captured three-letter agencies. And I saw that kind of spilling over into other functional medicine and holistic training programs, that they were still referencing these very corrupt agencies. And so I know that we both recognize that we need to get very to improve on these patient outcomes. We need to make big changes and bring back the critical thinking skills and the ability to do research, but then also the knowledge and skill set on how to help people heal their bodies holistically. So now that's so exciting that you have you've done so much with Remnant Nursing, which is now Remnant Healthcare, and I recommend Remnant Healthcare all the time to people. Tell me about some things that you're doing specifically with Remnant Healthcare.
Yeah, we're really excited. We've got some amazing programs that we're launching. So we do have the functional medicine aspect of it, where we're doing a lot of preventative medicine. We're doing our best to help people to get healthy, get them well, and keep them out of the hospital and away from this broken sick care system. So we're doing a lot on the preventative side and getting people de-prescribing, getting them off that prescription medication. They fall down that polypharmacy rabbit hole, and I mean, we know how harmful that can be. So we're able to get them feeling so much better once we get them off of those medications. So that's a big part of it, just that concierge nursing services and from a functional medicine perspective is huge. That's probably the largest portion of what we do. But we're really excited because we're launching other programs specific to PANS Pandas. We have a PANS Pandas program that we just recently launched in conjunction with the company NutriMedics that puts out herbal medications. And we've been able to treat these children who have, if you think about it, many healthcare providers don't even know what PANS and Pandas is, right? So to be able to get these practitioners trained in these regimens that are helping, it's like these children, their brains are on fire. There's so much inflammation, and to be able to manage their symptoms in an effective way and in an affordable way. If these families were going to specialists to have this done, it was going to be costing them, tens of thousands of dollars. And sometimes they don't get the results they're looking for. So we found an incredible way to do this with our nurse practitioners, with our nursing support team, and with in conjunction with NutriMedics, who provides the supplements. And we've seen amazing results for this, and extremely affordable. We're talking about probably less than $2,000, and we're getting these children well.
Goodness, like I think that you're doing God's work here, and with things like PANS, pandas, POTS, and all of these different conditions that are considered to be new conditions in the conventional medical world, and they're completely bypassing the fact that something caused this. We should look at what is causing it so we can work on a program to reverse this. But there's so many suffering children in our country right now, and I was like so excited to see that you were helping with things like PANS and Pandas, because there is a great need. And I just know that in our, we know that standard of care guidelines often are corrupted by big industry, and then it just ends up, creating these lifelong pharmaceutical consumers. And, yes, pharmaceuticals can help with your symptom management, but is it actually going to heal your body? So that's such like a needed niche. And I tell nurses all the time that, like, you can be successful in this field even if you don't have a niche, but having a niche could actually really help you get off the ground much faster. And that's and I think that you're just going to grow like crazy as you get more of these results, and also at like such a cost-effective program. Now, I know with functional medicine, for anyone that's listening that has not been through a functional medicine program, a $2,000 program is crazy affordable. And, with nurses coming together, we're able to offer things that are like more cost effective. And I've heard of, functional medicine programs from, say, MDs and things like that, that are between like 8 and sometimes even up to like 30,000 a year. And a lot of families can't afford that. So now with Remnant, I know that you guys have a program for your patients, but then you also have a program for nurses if they're looking to join the PMA. Like, can you tell me a little bit about how that works?
Yeah, absolutely. So we have this really affordable micro franchising opportunity, and we offer educational and entrepreneurial opportunities. So nurses can come in, and not just nurses, healthcare workers. That's why we ended up rebranding to Remnant Healthcare, so that we can be more inclusive of these other disciplines. We understand that it's more than nurses. We're going to need OT, PT, all of the disciplines coming together, doctors as well, in order to create this parallel system that we so desperately need. But yes, we offer incredible discounted trainings, like as yours, Functional Nurse Academy is that's pretty much our flagship program that we have all of our nurses go through, but we also offer a program on homeopathy. We have a course on IV therapies. We have a course that we are launching for ethical principles of nursing. There's another one, and I can't think, the PANS and PANDAS. We train you on the PANS and PANDAS regimen. So what's interesting about all of those trainings together are probably less than $10,000 for all of that training. So, to your point, it's very affordable, and it's just one more way that we can get everybody trained again in a more holistic manner that can really get people being able to provide this meaningful care for people. And I think one of the other things that I really want to make sure we mention is that we also provide advocacy services, which is extremely important. As you know, I worked through the pandemic at the bedside, and I was seeing what was happening inside of our hospitals, and it's absolutely criminal what's happening. Patients are dying, and they are dying because of the deadly hospital protocols that they are using, that these captured government agencies are sending down these protocols, and the doctors, unfortunately, and hospital administrators are just following it to the letter, despite the fact that it makes zero sense to do so, and people are dying. So I think it's so important in the value of having an advocate to be able to navigate the complexities of this healthcare system. So we have nurses that are trained in advocacy that will advocate on your behalf, but we also have nurses that are trained in, specially trained in medical kidnapping cases. We've actually advocated just recently for the family of a 4-year-old child that was medically kidnapped at Lucille Packard Children's Hospital over in Palo Alto, California. And we were able to successfully get this little girl home. That it was just one intervention after the next, and it triggered a cascade of events that really led to her declining health. And thankfully, we were able to get her out of that situation and home with her family. Because unfortunately, the message from the hospital is if you question the narrative, if you question anything that they're doing, they call CPS. And they will try to strip your parental rights away if you do not follow their protocol to the letter. So what's the message there? Just shut up and let us do whatever we want to your child. This mom was simply just advocating for a gentler diuretic to be used on her daughter. And for that, she had a CPS case opened on her. And they literally tried to bar this family from the child in the hospital. Kind of similar to what we saw with the Maya Kowalski situation.
Yeah. So, oh goodness, bless you for doing that, because, and that was another thing with nurses going into private practice. There are we have a really high skill set, and there's so many things, there's so many different services that we can offer that can be of just such tremendous value. And I can really relate with you on the need for like nurse advocates that are outside of the system that understand the protocol, and also understand that like sometimes a lot of these like standards, the standard of care that they use in the hospital setting, a lot of times there's not good supportive evidence for these protocols and treatments that they're using. Sometimes the protocols that they're using are really just based on rhetoric. And the further you go down the rabbit hole, you see that there are, financial incentives, and there's big industry that very much so has a lot to, sorry, it's my baby brain right now. I have a 4-month-old baby.
I understand. You get the baby brain, have the menopause brain, and we're all good.
Yeah. Okay. Yeah. But anyway, but they influence the guidance by funding. We have pharmaceutical companies that are paying money to these large organizations, such as like the American Heart Association, the American Diabetes Association, and whatnot. So there's so much corruption that's out in the open. But when we have this conventional medical model, there's so much groupthink. People are so overworked, and they just go along with these protocols without thinking about why are we doing this. And I actually had a personal experience when I had my beautiful baby. She was actually hospitalized in the NICU for 4 days because she had a little bit of fluid in her lungs, and I had her in the middle of the night at like 3 a.m. I had no rest, just had a baby. And even with my medical knowledge,
I was unable to properly advocate for her because, my baby's in the hospital. I just gave birth. I was a wreck. And my husband is really intelligent, but he's an engineer. He's not medical. And we were both so distraught that our baby was in the NICU. So I am like so happy to hear that you are doing this with the advocacy. And I think that this is just gonna like grow like wildfire because you just cannot put, I mean, that is just such like an invaluable service because by getting nurses involved and being able to advocate for safer protocols. I wish in the year of 2024, we were not having to discuss the issues of medical kidnapping, but this does happen across our country. So I think it's really amazing that like, family members know that they have this type of service. And so what are your, it seems like with Remnant, you guys are just doing so much and you're growing so fast. So can you tell me a little bit more about like, your future plans for Remnant?
Yeah. So yeah, like I said, we're expanding to Remnant Healthcare. And so we are a very unique model. So we are completely outside of the mainstream system, which is, the biggest badge of honor that I have is that we are completely outside of the mainstream system. We're functioning under a 508c1a private membership association. And our model is very unique in that the nurses will come in. It's a very affordable buy-in to practice under the protections of our PMA, and they also get all of the resources that we have to offer, including marketing, including basically we're giving them. I like to call it training wheels for nurses, and it's basically giving them all of the tools that they need in order to successfully have their own practice under the protections of Remnant. As you know, when you're getting ready to start your own business, and many of these nurses, remember, don't even realize that they can be anything other than a hospital employee. That's like new information to them, that they can actually like be the CEO of their license and they can do something else. So I think that once we change that mindset, we get them the education that they need in the functional medicine, and then we give them all of the tools and resources that they need to show them that they can be successful on their own. A lot of the nurses will then go ahead and branch out because it's costly, right? To start up an LLC, to do all of the things. This kind of allows the nurses to kind of dip their toe in and figure out if this is something that they can do and that they want to do. And we have a very unique revenue sharing platform. So it's a very affordable buy-in. It's $1,500 to come in initially. And to that, you get all of the access to our resources and our services, and of course, to the discounted educational opportunities such as your program and others. So it's very unique. And we've had just 100% positive feedback from the nurses, from our clients. Everybody is thriving with this nurse-driven care. And that's really what it's about. It's nurse-driven healthcare, where we are encompassing other disciplines, but at the core, it's the nurses. And we know that the nursing is the backbone of any healthcare system. No system is going to sustain without its nurses. And that's kind of where we go, and we look to the nurses to be that core and that driving force behind the services, exceptional level of services we provide to patients.
Wonderful. And I sound like a broken record. I say this like all the time, but I feel like it's going to be us nurses that are going to clean up this
Oh, it
healthcare
is
mess. And of course, we need like the
100%.
other disciplines, but in healthcare, we are the ones like for years and years and years, and this probably has changed since COVID, but we were like the most trusted profession. And then also in healthcare, we're the ones that spend the most time with the patients. We're the ones that are building rapport with them, and we have like a much higher level of understanding of their needs. So I am so happy about what you're doing. And yeah, I would definitely encourage anybody to consider joining Remnant, and then also for sharing this with like loved ones and family members, friends, and just to help to get the word out there about Kimberly's amazing organization. And I did have a question, like so say that there's a nurse that has her own concierge functional practice, and like they're operating in their own LLC and seeing clients here and there. Would they be able to also join Remnant as like for supplemental income?
Absolutely. Yes. We have no, I don't believe in non-compete clauses. I
Yes,
will not sign a
awesome.
non-compete clause. I encourage people, like if they don't have their own business, we encourage you to join, and I encourage you to start up your own business. The only thing that we ask is that you see some Remnant clients for a period of at least 2 years. That's the only thing that I ask. But other than that, no, you can see your own clients, and we ask that you don't take our clients
Yeah.
on your own. But yeah, absolutely. We will happily, take in other practitioners. And in addition to that, if they don't want to practice under Remnant, we understand well that we want to take care of everybody, that we're not going to be able to care for everybody, but we want to make sure that everybody has access to safe and appropriate care. And to that end, we have a referral network that we are building out. So if we have a client that we can't take care of, then we can refer them out to, somebody that's trusted, a trusted and like-minded provider. Because listen, the medical system is so broken and people are so distrustful of it. So they come to us all the time looking for those types of like-minded providers. So there's a lot of value in coming on board and coming beside what we're doing at Remnant, to build out the system. And it's going to take all of us. It's not going to be any one individual, any one organization. It is going to take all of us to fight this together, because the fight is massive and we can't do it alone. So I think all of us coming together and investing in and creating what, the system that we want to see, and be that change, that's going to be life-changing for all of us. I really feel that.
Yeah, yeah, and we know with this big mess that is the conventional medical system, and then we have all these government bureaucrats that know very little about health and often are making guidance based on conflicts of interest. So we've seen that people are so distrustful, but as nurses, we understand that sometimes there is a time and a place for medical management. And there are many situations happening across our country where people are so distrustful that they are avoiding essential medical care. So I love that you guys are helping to rebuild that trust, because there are providers sprinkled in the system that may be in network with insurance that we can trust, who are using their critical thinking and really do genuinely care about their patients. So I think it's great that we kind of work together on this. And I love that you are, not competitive with other, practitioners out there, because, we need to come together to really help our communities. And the system is so incredibly broken. There's no shortage of patients with chronic diseases, and functional medicine is the demand for this is high. The demand for functional medicine, the demand for seeking care outside of the standard medical system is incredibly high right now. And patients are seeing the value, because, to bypass the system, you're very likely, for the type of services that, Remnant is providing, these are direct pay models. But when you look at the big picture, you may pay a little bit more upfront, but long term, it's going to save you a lot more money, because you're not going to be, pharmaceutically dependent, at risk for early disability and death and things like that. You just can't put a price on,
That's
the
so true.
suffering and
It's so true, Melissa. I say it all the time. I'm like, you're either going to pay a little bit extra on the front end, or you're going to pay for it later in disease and despair. You have to make a choice. And I always say, our membership to Remnant is $30 a month. I think most people pay more than that for their combined streaming services. So it's really about prioritizing. And our services cost a little bit more, but we still do keep it very, very affordable, because we want people to be able to access our services. I just had this conversation the other day, because we get compared a lot to a DPC model, and we do have some similarities to a direct, because we are a direct pay, but we're not a DPC. So, because some people will say, oh, okay, well, I can pay $100 a month and I get everything included, but that's one provider, and it's probably one allopathically trained provider. So we have a revenue sharing model. So obviously we have to be able to compensate our nurses, but you're also getting a different level of service and a different level of care, because again, we're doing that functional medicine aspect, and we're getting to the root cause, and we're getting people well. And there is no price tag you can put on getting yourself and ridding yourself of chronic illness. And you know that you can speak to that because you've had a chronic illness that you were able to reverse on your own. And you had to do that because you were abandoned, like so many others. You were abandoned by this traditional medical model. And unfortunately, the DPCs, while they're, I think they're great. It's a great model, and that's definitely the way medicine needs to go, but it's not always as it seems. They are a lot of times still accepting insurance. When you accept insurance, you have to follow certain CMS guidelines and FDA regulations and all of that. And I think it's important to recognize that you're going to pay a little bit more for nurses and practitioners that are trained in this type of functional medicine because they are putting a lot more work in to your case, a lot more research into your case, and they're truly digging in and getting to the root cause, not just, oh, you have these symptoms, here's the recommended prescription for this set of symptoms. And that's what happens even in the GPC model. I think it's important to recognize that.
Yeah, and that's the thing that's huge. And when I was really sick, and it's like scary when I think about like what would have happened to me if I just listened to every conventional doctor and then took all of the medications they were trying to get me on. Like, I don't even want to think about like what my state of health would be like now, and my quality of life. But yeah, it is really important that when patients are looking to work with an alternate practitioner that's operating outside of the conventional medical system, that you vet them really well, because like I said before, there are there's a division even in, holistic and functional medicine of providers who say that they are holistic and they may be practicing a little differently than from a regular conventional provider, but at the end of the day, they're still following these standard guidelines from our three-letter agencies that got us into trouble the first place, and not using their critical thinking skills.
That's my litmus test. If you're following any kind of CMS, FDA, CDC, no. Like, we've got to do something different. If we want a different result, we've got to do something new.
That is the definition of insanity. When you do the same thing over and over, expecting a different result. But yeah, I was looking for a referral the other day, and it was a functional provider. And I saw that on their website, they were directly quoting the CDC. And I was just like, and I know in my courses, sometimes I may quote CDC data, but I always do that with like a disclaimer. I'm like, hey guys, it's from the CDC. This is all I can find.
Take this with a grain of salt.
Yeah. Yes. So, okay. Well, yeah, this is great. Like, I think this is like so exciting, and I'm going to be, posting the, links for Remnant. That way, if you want to learn more about Kimberly and her association, you'll have that resource. And, I did, want to ask, now I was just so like happy to have you, go through Functional Nurse Academy. Kimberly was actually in our very first cohort that started in, fall of 2022. And can you tell me a little bit about your experience going through Functional Nurse Academy and how it helped with your success?
Absolutely. Yeah. So what I loved about it, now this was live, the course was live, but it was also like self-paced. Everything was recorded because my schedule is insane. So what I really loved about it was that, I had the ability to kind of go at my own pace and watch the videos when I wasn't able to make the live courses. But, having you there for guidance in questions when I needed it was invaluable to me. And I learned so much. I mean, I've been in healthcare for 27 years, and I learned more in 6 weeks of functional medicine training with Melissa Schreibfeder than I have in 27 years of healthcare. So, I mean, I think that's just an incredible testament to you, and just the way that you've organized your program. It's so streamlined, so easy to understand, and to have that support is invaluable. And then when you throw in your practitioner toolkit, that hands basically all of these incredible resources for the nurses who, again, we're coming out and we're so like confused and questioning everything, to be able to have that all simplified and streamlined, again, invaluable. So it was a great experience for me. And I know my nurses cannot speak highly enough of this program. They're coming in and they're all so hungry, like I was, to learn something different, and they are also just overjoyed when they go through your program and realize, they start to feel like, this is why I became a nurse. This is why, so I could help people and keep people well. And we can't always get people well, but we can do so with with compassion, and we can show people the love and the dignity, because sometimes all we can do is comfort them, right? But when we have the ability to get them well, that makes all of the difference, and it's the very reason we all became nurses.
Yeah, and it's so amazing to get back to that like purposeful work. I
Yes.
know that when I started working in the hospital system, I felt like a Pez dispenser for medications. And now we can
Exactly.
actually go out there and help people heal and do God's work and make a difference in this world. So,
Absolutely.
well, thank you so much for the kind words about the program and sharing
Thank
your
you.
story. And I just can't say like enough like wonderful things about Remnant and how excited I am for you and all of your future
Thank you.
accomplishments. So, I hope you have a wonderful day. And again, for anybody listening, I will put all of Kimberly's links down below. So have a great day.
Thank you so much.